Hi, during my last video, I told you that scavenging system is one of the solutions to the problem of pollution in the operating theater. But the question now is, what is scavenging system? What is it all about? So this is what we are going to be discussing at the course of this lesson. My name is Adebayo Christopher Adedonyi. I'm a medical sales rep. We supply anesthetic consumables to Nigeria hospitals. So today we are going to be discussing scavenging system in the operating theater. Please note, scavenging the operating theater will protect the medical personnel from inhaling the waste anesthetic gases from the patient. And this is very important because there is a limit of these waste gases that are allowed to remain in the operating theater so that it will not be harmful for the medical personnel. Like in the UK, it was recommended that the nitrous oxide must not be more than 100 particles per million in the operating theater. Enfluorine, isoflurane, desflurane must not be more than 50 particles per million, while halothane must not be more than 10 particles per million. And lastly, sevoflurane must not be more than 20 particles per million. So all this thing has a limit to which they can be allowed in the operating theater. Okay, so that the medical personnel can be saved from all these waste anesthetic gases. So now, what is scavenging system? Scavenging system is a system introduced into the operating theater to collect, transfer, receive, and dispose waste anesthetic gases from the breathing or ventilating circuit to the atmosphere. It is made up of four different units: the collecting, transfer, receive, and disposal. So I'm going to be discussing all of these things using the two types of method. And what are the two types? We have the passive scavenging system and we have the active scavenging system. Now, what is passive scavenging system? It is a system that involves the upstream flow of gas coming out from the machine to passively flow out of the system into the atmosphere. It involves the 30 millimeter shroud connector attached with a tubing which is connected to the breathing circuit or the expiratory valve of a ventilator, which help to transfer these waste anesthetic gases from these two units down to the receiver's unit. So this is a breathing circuit. This is a breathing circuit. We call it Macosin D or Bain circuit. So it has the two ends. We have the patient end and we have the machine end. But I'm going to drop this patient end because it's not important to what I'm about explaining. All right. So this is the machine end. And the reason why we call it the machine end, it is because it is the part that is closer to the machine. All right. And on this part, we have three different ports, which are the machine port, the reservoir port, and the scavenging port. This is the port through which the waste anesthetic gases from the patient pass through. So the 30 millimeter shroud connector is being connected to this unit, which help to transfer the waste anesthetic gases from here down to the receiving unit. Lastly, on this unit, you may want to ask me, why is it that among the three ports, the scavenging port is the largest? Why not the normal 15 millimeter connector, like the case of breathing circuit? It's like that because it's to avoid misconnection, especially during emergency. At the receiver unit, the system may be made up of a reservoir bag which is loaded with two spring valves of positive and negative pressure, which help to relieve the pressure in the system. The positive pressure valve helps to prevent barotrauma in case there is an occlusion at the distal end of the system. Mind you, anything positive, it gives out of the system. So as it's giving out, in case there is an occlusion at the distal end of the tube, so you see the valve open up. So thereby relieving the pressure that would have built up within the system. So that is for the pressure valve. While the negative valve help to prevent the collapse of the reservoir bag and also prevent rebreathing of the system. What do I mean by this? You know, anything negative is receiving. So if what they are receiving is not enough, so maybe the system is demanding too much. So instead of the pressure to build up within the system, the negative pressure valve will open, relieving the pressure of that system. So that is for the receiving unit. Lastly, at the disposal unit, the system is made up of a copper pipe that help to convey these waste anesthetic gases from the system down to the atmosphere. All right, the other type now, which is active scavenging system. In the active scavenging system, the collecting and the transfer unit, they are the same thing as that of the passive scavenging system. But at the receiving unit, the system is made up of a bacterial filter at the downstream and also a visual flow indicator. So all of these things, they have their basic function that they perform to the flow of these waste anesthetic gases. Lastly, at the disposal unit, the system is made up of a pump that help to generate vacuum, thereby leading to the flow of these waste anesthetic gases down to the atmosphere. Lastly, in constructing these two systems, the passive scavenging system does not require large amount of money compared to the active scavenging system. Thank you very much. I've come to the end of this video. So please don't forget, I supply anesthetic medical consumables to Nigeria Hospital. In case you are in need of any of these medical devices, you can as well contact me at any time. I'm always at your reach. Thank you very much, and God bless you.